Good evening. And after a wonderful session next door by Dr. Adarsh, I think we'll get down to a little more serious business, and this is the business quiz. And as you see on the screen, the quiz is on Kahoot. If you can open your mobile phones and log into Kahoot, there's an app, and you don't need to. I don't think you need to download it. You need to just maybe put your email ID and a name. The important thing here is that you have to type your name. If you put something like a rose or a lily, we don't know who's it, because eventually if there are more than one person, it'll be difficult to identify who's it. So you just write down your name, and see, this Kahoot quiz has got 30 questions. Some of them easy, some of them are not so easy, and some of them are outright difficult. And the good thing about this app is that as and when you answer, your scores will keep coming up, so we know who's in the lead with every question. And not just that, the fastest finger will get more points. You say a lot of people answer at the same time, the one who's answered the quickest will get more points. So if you're all ready, then we shall get going. Yeah, can they get the thing on screen? Oh. So a pin will come in here. You need to key in the pin, and then you'll be there. Yeah, get ready to join. Now the game pin will come on the screen, and you have to click that. The pin is 5356339. So as and when you log in, we can see your name on the screen. Please log in this. Five 356 is the column. I'm sure all of you have internet on your mobile phone, because some they're slow, then that be an issue. You may I can see color there. Can I have sound slightly more? Say more than 60 have logged in already. Are we ready? Anyone is still struggling to log in? Yeah. Mohan, you're not playing? Anand, have you logged in? Yeah, there's a request for the people standing behind to please come and sit in the front and play, because it's easy. Make yourself comfortable, please. Yeah. Please come in. I mean, if you want to complete the quiz. Shall we? Yeah, I think we are about, there's still some more coming in. Maybe I'll start when we are 100, because we are running late. So we've reached 90, 91. The screen looks so good, the color combination. Now, if the Spider-Man wins the prize, I do not know whether that will be a logical name. Anyway. Okay. Okay, 100 will be cut off. We'll start. Yeah, I'm starting. Okay, here we are. So welcome to the IASGCON 2022 quiz, and that's the first question. You need to pick the wrong option for hepatic adenomas. Please, you have 27 seconds to go. Just look up the options and see. You should click the right color. Inflammatory hepatic adenomas contribute to 40-50% of all varieties. The biliary ducts in these tumors are typically dilated. Seen in men consuming anabolic steroids, and these tumors regress with stopping oral contact. You get the right answer, click the right color. And your time is out. Now the right answer is the biliary ducts in these tumors are typically dilated, and 39 of you got it right, and we'll see who's the one who got the fastest finger. It's PJK. And hepatic adenomas, as you know, the OC pills, anabolic steroids, Fanconi anemia are associated. And the word hepatic adenomatosis refers to the presence of 10 or more tumors. And rupture is a common symptom of these, and about 5% undergo malignant transformation. Surgery with resection is recommended for all male patients, whereas regardless of the size, where a woman tumor greater than 5 centimeter requires surgery. Now, question number 2. Of hepatoid carcinomas, all are true except, time starts now. High-grade aggressive neoplasm when this particular thing is found in the stomach. No standard adjuvant therapy, high metastatic potential prognosis. Alpha fetoprotein and PIVKA2 are essentially normal in these patients. These are HCC-like tumors found outside the liver. Which one is the wrong response? I think this is a fairly easy one, and here we are, and a majority of you got it right. That is the option of alpha fetoprotein PIVKA2. They'll be high in these patients as well. Now Archit has gone up the ladder. Now hepatoid tumors are HCC-like tumors outside the liver, and then there are so many other associated features to it. Now we'll go to the next question, that is question number 3. This is an easy one. The youngest liver transplant recipient in the world had the transplant at the age of 5 days, 5 weeks, 5 months, 5 years. The youngest liver transplantation patient in the world had transplant at what age? 5 days, 5 weeks, 5 months, 5 years. And we are running out of time. You see the cute little baby there? And the answer is 5 days. Most of you got it right. I thought I didn't expect this to happen, and I think this between Archit and PJK, the fight is still on, and Kala is closing out. And that's the picture of the recipient and the surgeon that happened recently in Chennai. And this girl is, I think 20 plus years now, and she's a lawyer in the making. I mean, that's a wonderful thing, and the record still holds good. I shall move to the next question. Question number 4. Again, you need to pick the wrong response in regard to the Warsaw technique of distal pancreatectomy. A slightly, tricky question. Read the options clearly. First done in 88. Blood supply spleen is from short gastrics and right gastrocolic artery. Named after Dr. Robert Warsaw of Mass General Hospital. Both splenic artery and veins are ligated in this spleen-preserving distal pancreatectomy. Clearly have a look at the options and click them right. Now we are run out of time, and if you've seen the option I given is blood supplied spleen from short gastrics and right gastrocolic artery. I didn't say left gastrocolic artery. That is the thing there, and a lot of you didn't get it right, sadly. And now where are we? Archit is still leading. Now we shall move on to, this is all about a Warsaw operation, where you can still retain the spleen by ligating splenic artery and splenic vein while doing distal pancreatectomy, and blood supply is from the left gastrocolic and short gastrics as compared to the Kimura, the other procedure where you retain the blood vessels, which is slightly difficult when you do in a minimal access fashion. Now we'll move on to the next question. In pancreas divisum inversus, there is the main pancreatic duct opens in major papilla, the main pancreatic duct opens in the minor papilla. It's an isolated duct of Santorini, or there is an absence of major papilla. This is not such a difficult option. Please, before clicking, you look at the options clearly. Wow. Now, it's unfortunate that the majority went for the wrong option. The right option is isolated duct of Santorini. I'll show you what that means. Archit is still in the lead, and this is the third. C is where the Santorini or the ventral duct is separate, and you can see it coursing down, and that is what is called pancreas divisum inversus. A very uncommon feature, but that is what inversus means. We shall move on, and we'll move on to the next question. The editors of the book Healers and Predators are Dr. Samranandi, the Keshav Desirajan, who's a third person. I know, is he around? I do not know, but who's the third person? Dr. Piyush Sani, Dr. Sanjay Nagral, Dr. Subhash Gupta, Dr. Zulfikar Gupta. Not a difficult option for those who read this book or at least seen it. Wonderful. Most of you got it right. This is Dr. Sanjay Nagral, was holding a session this evening, and we'll see whether, the first time I see Archit going down, and Utpala must be a girl, I'm sure, going up the ladder, and 4 players have reached continuous 3 positive answers. We shall move on, and that is Healers, and it's quite a voluminous book, and if you get a chance to read, you should. And Sanjay Nagal is the third editor in that book. I will go to the next question, and this is one of those routine ones. Stellar trial. I think most of you know what stellar trial means. Is it neoadjuvant CT-RT versus upfront surgery in clear rectum? Is it short-term versus long-term RT in locally advanced rectal cancer? Is it neoadjuvant versus adjuvant RT in carcinoma rectum? Or is it short-term radio chemo versus long-term CT-RT in locally advanced rectal cancer? Stellar trial means this. I'm sure most of you will get it right, as I rightly said. Almost all of you got it right, and we'll see whether there's any change in fortunes of the winners. It's between Archit and Utpala at the moment. Kala is again still in the first 5. We'll see. Yeah, this is actually this particular stellar trial has shown that by giving neoadjuvant short course chemo radiation versus CT chemotherapy plus concurrent chemoradiation, there is some overall survival benefit. So that's all about stellar trial. We'll move on to the next question. An unusual question. The 2023 meeting of SSAT will be held in San Diego, California. It will be a virtual meeting, or in Chicago, Illinois, or Boston, Massachusetts. Where will this meeting be held in 2023? I'm sure some of you are members and some of you would be wanting to present papers. It's a difficult one, but I thought, you should keep your eyes open what's happening in the world. And the answer is Chicago. I didn't expect this to happen. Majority of you got it right. So all people want to travel, looks like all the very best to you. And Dr. Bala should help you out in that. Now I'll see whether there's any change in it's almost the leaders are more or less the same. The top 5 remain there. We'll move to the next question. This is of course, this is the 64th annual meeting. It will be in Chicago, Illinois. The question, this is maybe a simple question, but which is the gallbladder and bile duct awareness month? There's a month for every disease. Which month is this? January, February, October, November. The gallbladder bile duct cancer awareness month is which one? It's an easy one. I don't know whether Tata Memorial they celebrate this. You put out the whole hospital in green, I don't know. Like they do pink all over. Yeah, here we are. Oh, it's sad. That's not the right answer. The right answer is February. November, I think, is a pancreas month. Yeah, and October is the breast cancer month. No, it's sad. I think these bile duct cancer should get its due recognition, and it's February and not November, as most of you said. We'll see whether there's any change in fortunes here. The more or less the same. We'll move on. Gallbladder bile duct cancer awareness month is February, and the green is the ribbon. Okay, question. Yeah, Delilah trial is about. This is an easy one, I'm sure. There's some mention about this or a similar trial in the lecture hall next door a while ago. Poem versus lap Hellers for eclasia cardia, or Delilah trial is lavage versus resection for perforated diverticulitis, or is it surgical debridement versus percutaneous necrosectomy in WOPN, or is open versus laparoscopic cape resection for carcinoma rectum? Delilah trial is about what? It shouldn't be difficult, and I'm sure a lot of you should get it right, and I'm right there. Almost all of you got it right. It is a simple question, as I said, and it's more or less the same. You see, this is where conservative non-surgical management of diverticular perforation is the in thing now, and although short-term results are not so good, not in favor, but long-term results seem to be good in favor of conservative management. Now, next question quickly. Yeah, this should not be a difficult one. Who's that famous surgeon whose biography is titled More Than Just Surgery? Who's a famous surgeon? I'll say Indian surgeon whose biography is titled More Than Just Surgery. It's not an easy one, but I'm sure some of you should be able to make it. Yeah. And the answer is Dr. Hamilton Udwadia. Dr. Shrikant has written some other book, but it's not anything with this title. But then, good that many of you got it right. This is a biography of Dr. Hamilton Udwadia. And, well, the leaders remain the same. And that is the book. Life's Lessons Beyond the OT is what all of you should get a chance to read this book. More Than Just Surgery by Dr. Udwadia. I shall move on to the next question. It's a simple one. What are zones of rapport? These the three zones of the liver lobule, the three outer zones of prostate, zones of the retroperitoneal areas, and three zones of G junction. What are zones of Rappaport is a very simple one, especially for those of you who written entrance exams recently. And the answer is very simple. Three zones of liver lobule. I'm surprised that a retroperitoneal zone is also being considered here, but then they're the simple segment, zone 1, zone 2, zone 3 of the liver, and we'll see where we are. Yeah, I think people are sticking to their positions and not moving any further or going down, and these are the zones as I've just mentioned. Zone size is a very simple anatomical zones of Rappaport. I shall move on to the next question. Hirschsprung's disease may be associated with any of the following except Mowat-Wilson syndrome, Bacterial syndrome, Vandenberg syndrome, or congenital central hyperventilation syndrome. Hirschsprung disease may be associated with any of the following except. The answer is very scaring there, and I'm sure you would have noticed that. And we are running out of time, and the answer to this question is, I'm surprised. Bacterial syndrome is a group of conditions associated with anal agenesis and not Hirschsprung's disease. I'm sorry, I didn't know, I didn't understand that. The bacterial is a very common, especially for entrance exam goers, and we'll see whether there's any change. It's just the same. See, these are all the various conditions that are associated with Hirschsprung's disease, and bacterial is a different ball game altogether. Now we'll move on to the next question. There was a discussion about median arcuate ligament syndrome yesterday, and what are all the synonyms of this condition? It should be very easy. Wilkie syndrome, Dunbar syndrome, celiac axis syndrome, celiac trunk compression syndrome. The options are very easy to choose from. The synonyms for median arcuate ligament syndrome is all of these except. Very staring, and I'm sure it will be an easy one. Yeah, right. As expected, Wilkie is the SMA syndrome, and that should be kept as third or fourth option, maybe, I don't know, but that's the right answer, and most of you got it right. And here we are again with the, I think Kalai keeps getting pushed down and tries to climb up every now and then. We shall move on to Utpala is still there in the lead. Next question. Does the median arcuate actually a lot of patients seem to have this narrowing, all that don't have symptoms. Now we'll go to the next question. The latest version of that should be an easy one. The latest version of Da Vinci Robo is SIXXI. Which is the latest version of Da Vinci? We recently purchased a CMR Robo in our unit, which is the latest version of Da Vinci Robo. It's a little tricky, but I'm sure you'll get it. The ones who used it or the ones who read about it, and that's not the right answer. X is the right answer. I'm sorry, everybody have heard of XI, but they haven't heard of X, and that is not the right answer. We'll see where we are now. Yeah, Harilal is, I'm sure Harilal must be using Da Vinci. And now, if you see the evolution, 2006 S came, 9 SI. I had a chance to work with this 2016, and 2014 XI, and now 2017 is X. I gone missing. That was a bouncer. Next question is this. Indian Association Surgical Gastroenterology was founded in the year. Yeah, this was the simplest question ever. 78, 88, 98, 2008. Which year was this? Same year the SGPGA founded its GA surgery department. Which year is this? 78, 88, 98, 2008. Should be an easy one. Right. Almost all of you got it right. Actually, there's an emblem somewhere, I don't know, there. It's there everywhere, and you can, if you look into it, you can see that. 1988 is the right answer. I'm sure it will not change any fortunes to anyone over here. And we are still with the 5 people there. And now, see you can see the logo with that year it was founded. Okay, distal pancreatectomy with unblocked splenectomy and celiac axis resection is called modified. This is an easy one, obviously. Modified Appleby, radical anterior modular pancreatic splenectomy, sham procedure, or modified Ferguson procedure. What is this? Distal pancreatectomy with unblocked splenectomy and celiac axis resection is called what? What procedure? I'm sure most of you will get it right, and that is true. Almost all of you got it right. There's an easy option. And yeah, here we are. These are the leaders. And as you see, this was a procedure that was done for gastric cancer to start with. Now that's been people started using for pancreatic body tumors as well, and that is a modified Appleby procedure. Now I think we are more than halfway through. We'll just move on to the next question. Yeah, this is an interesting question. Paul Hendrik Sugarbaker and David John Sugarbaker of the Hypec fame are father and son, they are brothers, grandfather, grandson, uncle and nephew. There are 2 sugar bakers, and one of them are into the chest mesothelioma, the other one is the abdominal Hypec. These 2, how are they related? Is slightly, oh my God, uncle, nephew. That's a new relationship. The correct answer, brothers, they are brothers. David is the elder brother and Paul is the younger brother. Actually, if you see, we'll see, oh, Archit has gone back. I think he knew them personally. Maybe he's a family friend, I don't know. See, the issue is, this is called the mesothelioma family. Ernest Sugarbaker is the father, and the 2 sons are actually still, they're called the Mesothelioma Society, and they are into it. So they are brothers and not uncle and nephew, as somebody or most of you felt. We'll move on to the next one, and this question is the first easy one actually. The first professor and head of surgical gastroenterology at CPJ Lucknow. Dr. Rajan Saxena, Dr. S.P. Kaushik, Dr. V.K. Kapoor, Dr. Ashok Kumar. Who is the first HOD of SGPJ Lucknow GI Surgery Department? This is an easy one. I'm sure everybody should get it right. Right. Well, almost all of you got it right. Is Dr. Kaushik, who passed away recently, and Dr. V.K. Kapoor has written about him in the various social media platforms. And has it changed? It's between Harilal, Archit, Utpala. You should try hard now to, come to the top and prove the discussion that went on in the next neighboring room. That is Dr. Kaushik. That is written a couple of books, including the history of surgical gastroenterology of India. I have a copy of it, and in operative procedures in surgical gastroenterology, yet another book of his. He was my examiner in MCH examination. Okay, next question. It's an easy one. Over a 20-year period, cancer develops in chronic pancreatitis in what percentage of patients? Over a 20-year period, pancreatic cancer develops in chronic pancreatitis in what percentage of patients? 5%, 10%, 15%, 20%. An easy one, I'm sure. For those of you who read the literature on cancer in chronic pancreatitis, and we shall see what the response is like, and the answer is 5%. This is the literature proof. It includes Indian literature. So 5 is the right answer, not 10. We'll see where our contestants stand, and I think Utpala is tried a bit to move a notch up. Archit is in the lead. He's come back to it. Now See, that's where the chronic pancreatitis and pancreatic malignancies, is about 5%. Next question. A 65-year-old man with HIV is admitted with acute abdomen, sepsis, and a left colon of 7.5 centimeter width. The likely cause in this gentleman, old man of HIV, the acute abdomen, is Clostridium, cytomegalovirus, Salmonella, and Amoeba histolytica. What could be the cause of this acute abdomen and sepsis in this gentleman? It's an easy one again. Right, all of you got it right. It is cytomegalovirus, and this is where the leaders stay. I was expecting some new name to just come up quickly, and then with this, I think we have done almost. We have maybe 4-5 more questions. We'll move on to the next question. Oh, this is the toxic megacolon that you had seen in these patients, cytomegalovirus infection, the grossly dilated colon, non-obstructive colon actually. Next question. Virtual ileostomy. What is it? Is it unmatured, unopened ileostomy constructed where we just don't open but bring the stoma out? A pre-op planning of ileostomy site on an image monitor using a software, or is a loop of thread passed around the ileum and brought out to the surface for a later ileostomy if necessary, or creating an ileostomy using a colonoscope? So what is virtual ileostomy? It's also called ghost ileostomy. What is it? Wonderful. A lot of you got it right. It's just a loop of thread is passed around and brought into the skin to just mark the site of stoma in case it is necessary, where you need not go in and do a bigger procedure. And with this, we see the scores. Scores, the table looks more or less the same, and that's how virtual ileostomy look like. You see, you just thread around an ileum and then bring it out, and suppose if it's not necessary, simply cut off and that's done. But if necessary, it's easy to pull the loop out, and it's an easy procedure. We'll move on to the next question, and that is typical knife cut ulcers that you see in this picture. Knife cut ulcers seen in arsenic poisoning, Fournier's gangrene, advanced tinea cruris, or Crohn's disease. It's an easy one again. Which condition will have this typical knife cut ulcers? And the answer is Crohn's disease. More than half of you got it right, and this typical knife cut ulcers that includes fistula and ano is a very typical Crohn's disease condition. And there we are with the leaders, and that's how a typical cut, and with proper medical management of Crohn's, they disappear. Okay, the story of a 75-year-old diabetic asthmatic with acute abdomen. He underwent colonoscopy recently. The picture is not representative, but nematosis intestinalis is seen on imaging. What could be the cause of nematosis intestinalis in this gentleman who's 75, diabetic, asthmatic, who underwent a colonoscopy recently? Alveolar rupture, mechanical mucosal disruption, gas-producing bacteria, or medication-induced? Not an easy one, slightly tricky, but I think you can have a fair amount of guesswork. Right. A lot of you got it right. Mechanical mucosal disruption is the cause for this nematosis intestinalis. In the etiology, necrotizing enterocolitis is different. Here we are, the scores. Yeah. Now we should understand that we have only 4-5 questions more to go, and the one who reaches the top is the winner. So be more attentive. that is pneumatosis intestinalis. Okay. Again, a 74-year-old diabetic with chronic liver disease admitted with sepsis and liver failure and gas in the liver. CLD, liver failure, sepsis. What is the diagnosis? Have a look at the picture. Liver abscess, portal pyemia, emphysematous hepatitis, or pneumobilia. Not a difficult question. What does he have? We look at the gas pattern, you can make out. Emphysematous hepatitis is the right answer and not portal pyemia. There may be a bit controversy, but that is the right answer. We'll see. Where Mohan is climbed up from nowhere. Now that should be a photo finish as we go on. That is emphysematous hepatitis, a near fatal condition, and this patient, as I told you, already has a liver disease and is diabetic. Right. IUD inserted 20 years ago, not taken out, some sulfur granules all over it. Patient has multiple pelvic abscesses and one of the abscesses gone to the hip joint. What is this? Is candida infection, endometrial cancer, pelvic tuberculosis, or the actinomycosis israeli? Shouldn't be a difficult one. Again, IUD inserted 20 years ago and forgotten. And the answer is right. I mean, this has the maximum positive responses. 93 of you got it right, and Utpala just slid down. Now, actually, majority of these patients with actinomycosis israeli infection, actinomycosis in the pelvis are due to a forgotten or neglected intrauterine device, and this device has to be changed frequently. That's the moral of the story. Now, the last but one, possibly, 54-year-old lady's incidental findings: a starry sky appearance in MRCP. A starry sky appearance in MRCP is multiple cholangiolitic abscesses, multiple biliary hematomas, miliary tuberculosis liver, bilious hepatitis. What is this? Shouldn't be a difficult one either. What does the MRCP show? And the answer is not. Multiple biliary hematomas. Again, wonderful, most of you got it right. A couple of them, as noted as bilious hepatitis, is not so, it's multiple biliary hematomosis. And we'll see the scoreboard now. Scoreboard looks more or less the same without any change. And then I think we had just one or two more questions. Okay. So this is the biliary hematomas, are also called von Mayenberg complexes. These are multiple bile duct hematomas or biliary microhematomas. This is a 62-year-old post-liver transplant lady. What is that? You see a clotted blood from hemophilia, a biliary cast syndrome, extricated pulmonary embolus, or a vanishing bile duct syndrome. 62-year-old lady who had liver transplantation. What is that you see in that image? Shouldn't be difficult because this is a not so uncommon condition in the transplant scenario. You are right, most of you are right, you got it right. It's 74 of you got it. It's biliary cast syndrome. It can be seen anything from 2 to 16% of all patients had liver transplantation. And where are we? Archis is gone down. Harilal is holding fort. I think there's one or two more questions. Let me check. That's the biliary cast syndrome. And some of these casts can be extricated by ERCP. Yeah, this is the last but one. A 62-year-old woman with severe abdominal pain and on treatment for vaginal discharge and pelvic inflammatory. What is it? You just have a look at the picture. What is the diagnosis? Is it plastic peritonitis? Is it resolving acute pancreatitis? Is it Fitz-Hugh-Curtis syndrome? Or is it peritoneal mesothelioma? This is the last but one question. And the correct answer to this question, by looking at the picture, is wonderful. It's Fitz-Hugh-Curtis syndrome, very typical of this pelvic inflammatory disease, and that's seen in an old lady. And we'll see what the scoring now. Yeah, just the same, more or less. Okay, we move on to the. That is what is called a Fitz-Hugh-Curtis syndrome. I haven't seen one, or maybe I have, I don't know. These are all additions, benign additions you see when you put in laparoscope. And we go to the last question of this quiz, and that is, other than Dr. Hampton Woodwardia, which surgical gastroenterologist won Padma Bhushan? Which only other, it's Dr. B.M.L. Kapoor, Dr. Rangabhashyam, Dr. R.C. Aranya, Dr. S.P. Kaushik. Which other surgeon other than Dr. Woodwardia has won Padma Bhushan? It's an easy question, and with this we come to an end of this quiz. And the answer is right. Most of you got it right. And that's my teacher. I did MCH under him, and is one of those giants in the field of GI surgery. One of the first GI surgeons to get Padma Bhushan. And with that, we'll come to the score. Here we are. And the third is Archit. Archit, where are you? Harilal. Shashank is 2. And Harilal, yeah, you should come here, and I think the organizers should take a note of the names. Congratulations. Harilal, where are you from? You have a microphone? Introduce yourself.
Hi, good evening. I am from Chibbar, Pondicherry.
What are you doing?
I am second year MCH senior resident.
Congratulations.
Thank you, sir.
He is first in the list. Yeah. Bye. Thank you. Shashank?
Good evening, sir. I'm Dr. Shashank Agarwal. I'm from Max Hospitals, Vishali and Parpragan, sir.
Congratulations. Archit?
I am Dr. Archit Gupta from Medanta, the Medicity, Gurugram.
Congratulations to all the winners, and again thanks for all of you participating in this quiz, and I think with that we will come to an end of this. Thank you so much.